So this one is called a hub, H-U-B, okay? And this is the needle that comes. There are hubs that already comes in with the needle ready to go. But if your clinic is the manufacturer that they order their stuff comes separately, so you have to put them together. How you put this from here, the white part is always the tube that transfer. This is called a safety. This is the safety. The green part of the needle is the cover. Okay? So the safety is always towards the needle. You twist the clear part.
Ooh.
This is okay? This is the clear part. You just put that through your hub and you twist it. Now you're ready to go. Okay? So for my blood draw, I'm gonna have to bring my supplies. So let's just say that I brought 2 of this in case the first time I miss. I'm ready for another one. I brought few tubes. The reason I know which tubes to bring, because I already did my research. Well, you guys will learn about it in the future, like later on, which tubes to bring with you and how much blood to draw from your patient and which color has to go first. We will learn about this, so don't rush. And then I brought my wrap so I can put it on my patient. I have my alcohol wipes, I have my gauze, and I have my tourniquet. Let me ask you a question. What can I do if my patient is allergic to tourniquet? I can't put this on my patient's arm and I cannot go without cutting that blood circulation to collect.
Do you have a non-latex tourniquet?
Nope, I don't. Nope, I don't. That wouldn't work.
What do you use?
These?
Yeah.
Sure. You can use this. That's one option. I don't have these either.
Can't you make them have to
The
drop?
gauze that if it's a wrap,
Yeah.
sure. But I don't have those either.
Use your gloves.
Use my gloves? Please don't. No, don't.
Can you use your hands? Can you use your hands?
No, I can't.
Remember like an AC
Nope,
bandage?
it won't work.
Like the wraps? She just said we don't
Nope,
do that.
doesn't work.
She just we have
Nope,
those during
you need to get that blood.
Oh wait, what
in
about
this
like
scenario.
having it held up above your head or you have blood?
No, you wanna collect the blood draw. What did you say?
Change areas so instead of
No.
going, okay.
You will use your BP cup.
Oh,
BP cup?
genius.
You use your BP cup.
Genius.
I know.
Oh, yeah, okay.
Blood pressure cup.
Yeah, that makes sense.
You put the blood pressure cuff on and you pump it. That applies a tourniquet right there. Okay? Just in case there are options. Or all you have to do is do not go over their skin if they're not severely allergic to it. Go over their like put a clothing something. Go over the clothing. Okay? These are options you can do. Let's say that the first time I put this on and I can't feel my patient vein. Some tricks that you can use. Always have your patient stand up. The tourniquet, we did say 60 seconds, but if it goes a little bit over 60 seconds, it's not gonna kill the person. So don't be like, all right, your time starts now. Okay? Don't do that. So have the tourniquet on, have them stand up and make a fist and swing their arm a few times. Up and down, up and down. That pushes the blood flow down and you can feel the vein better. Or you can use a heat pack.
Use the what?
Heat pack. Okay? That's another trick. What other tricks can we use? Oh, always trust your patient. So if Diana is my patient, I'm going to ask her which arm would you like me to go. If she says right, I'm not going to go left. I'm going to take her words because she has gotten blood draw before, so she knows what she's talking about. I hope. Trust your patients. They will tell you which arm to go to, okay? Same thing in here.
Are we gonna learn the flashlights to find the veins?
I don't have those. I had them. Radiology borrowed them. See if I can have them, but no, well, it's not. It doesn't happen to a lot of clinics. They don't do it. First, same thing in here. Okay. From here on, if you have questions, write it down. Everything the same. You go to your patient room. You have your order. You have to have your order always. This is a blood draw. You cannot do it without the provider order. You are to ask the questions if they're taking any blood drawn, if they are in any blood thinner, if they have any allergies, and if they faint. You do not ever want to have your patients who easily faint. You want to make sure they have, we have a phlebotomy chair right there, or always have them lie down. Okay? Syncope. So do you have any experience of syncope? But we don't use terminology with our patients, so we always ask, do you have any history of fainting? Do you want to look when I do the blood draw, or do you want to turn around? And if they say, yeah, I don't want to look, find something so they can look at it. Find, see if there's any brochure around. You want to be on your phone, be on your phone, okay? Stress balls, anything you can find. Don't ever lie to your patient. Blood draw hurts, guys. So don't say, oh, you know what, it's not going to hurt. You got this. Yeah, there is a chance. Yeah, it might hurt, but I'm going to try my best to do the best I can. And don't ever bruising. You never know when a person bruise. Have you ever got hidden on a table or wall something, and then out of nowhere you have a huge bruise? So your body just reacts the way that it does. You never say, no, you're not going to get any bruising. I'm so good that you're not going to even feel it. Bruise, there's a chance that you could get a bruising, but again, I'm going to try my best to avoid it. Okay? We never can control that. Identification is on, your PPEs are done. Now we're going to go ahead. Prior for me to put my gloves on, I'm going to have my patients which arm would they like to go. And is it okay for me to touch it? Perfect. Lift your arm up, please. So this one always needs to be under the patient arm. My patient said left. Is that your right or left? Right. The patient says right. I always find my vein first, then I'll do my blood draw. So I'm just going to go ahead and stand up. Fingers up. All right. Go ahead and put your arm down. Don't let me lift it up. Beautiful. And would you mind making a fist for me, please? Perfect. Palpation, not inspecting, guys. You only inspect to avoid any scarring, bruising, but always palpation. I always close my eyes and feel it. Palpating it from side to side first. Once I feel the side to side, this is her median cubital right here. And then I can feel up and down the flow that it travels. And right here, her cephalic. So I really like her cephalic. It's pretty juicy. I'm going to go ahead and go to her cephalic. So this is the area I want to go. Now that I'm ready, find my vein, I'm going to go ahead and set up my staff. You could get these ready if you want. Strong some. I'm going to put this right, and you can relax your face. I'm going to put this right under your arm here. I'll have that ready for it just in case. It doesn't ever hurt to have extra alcohol wipes. Different methods I'm going to show you with the alcohol wipes in case some patient, look at that. Good, it may always prepare. I'm going to have my gloves on. I'm going to make sure my supplies are all set up in the right way. So remember, these sharp containers are never sitting up next to you. They are always on the wall, okay? But always make sure they're the side that you are poking the patient. So if I'm right-handed, I poke my patient with my right hand. I want to make sure my sharp container is on my right side, okay? And then my supplies, I want to make sure they're on my left side. Because when I'm poking my patient, I do not want to reach over. Because if I hit my hand, I'm going to hurt my patient and everything. I have to probably start from the beginning. So your supply always should be on the opposite side. Your sharp container is going to be on the side that you're poking your patient. Now that I found the area, I'm going to grab my alcohol wipe. I'm going to have you turn your hand a little bit, twist it for me. Beautiful. Leave your alcohol. Do not touch the side that you are going to clean the patient. Start from the middle, work your way out. Again, do not touch that. Do not fan that. I'm going to let that dry. While I'm waiting, I'm going to have my patients lift their arm up. Okay. Do not let me lift your arm up from here on. I'm keeping an eye the area that I clean. But just in case I miss that, no worries. Go ahead and put your arm all the way down. So you don't want the arm to be bending. Always try different methods. People might have their fist under it. They might put some stuff under that to kind of like hold this area up. Try that if you want. If not, then you don't have to do it. Bring your shoulder all the way down. Good job. And I want you to twist your hand. There you go. Okay, just gonna feel one more time. Since I touch it, I'm gonna clean one more time. Let's say that hers is not as easy to see. I'm gonna get a brand new alcohol wipe, put it right here, because my gloves are not sterile, right? Safety out of the way. I'm gonna open up my needle. Would you like me to count or just go? Okay, so if by any chance you miss the area, oh my goodness, I don't remember where I go. One time, you get to tap the alcohol wipe and tap the area. That's it. One time. From here on, if you miss it or anything, then you have to start everything from the beginning, clean that area, okay? Did you say count or just go? All right. Take a deep breath in. 3, 2, 1. Beautiful. How are we doing? And do you see how my 3 fingers are on the side? Holding it? Perfect. Now, the first thing that I want to take out is going to be my tourniquet. My other hand is still tourniquet. My second thing is my tube. Tube comes out and my patient face is relaxing. Before I put my tube out, I'm just going to go ahead and invert my tube few times. And then I'm going to grab my gauze. I'm going to have my patient take a deep breath in. And needle, safety, sharp. Okay? From here, I'm just going to hold this for a few seconds because I don't trust my patient that they put enough pressure on it. So I'm just going to hold that for a second and I'm going to ask, how's my patient doing?
Good.
Good? Perfect. Bleeding stop, no bleeding at all. Okay, this is all good to go. I'm just going to get one more gauze here. And I'm going to get my wrap. When you do put your wrap, go ahead and lift your arm up for me. Please make sure that you're not stretching these guys. Otherwise, you just applied another tourniquet. So this area might be still, you just poked it. So just nicely wrap this, not pulling it. And we're just gonna watch our patient for at least 15 to 30 minutes. So 15 minutes, 20 minutes, and then confirm with our provider, and then we're all good to go. If your patient is feeling dizzy, you're going to make sure that they are safe, lying them down. If by any chance, as long the needle is not in, if they're, as soon as they are like, I'm feeling dizzy, I might faint, stop what you do, grab the head first. Always head, make sure the head is safe. That's why you always want to make sure that you sit down on phlebotomy chairs or lie down on the bed. If they do feel dizzy after that, you want to make sure that you transfer them the bed, not to have them get